All right, I want to get to some of these awesome YouTube viewer questions as we kind of get towards the end here. Liana asked another great question: are polyps a type of fibroids? And I wanted to actually address that earlier. Patients come in asking about polyps and thinking they have fibroids. Polyps, Liana, are not fibroids. Polyps are a whole different story. Polyps are an overgrowth of the lining of the uterus, the endometrium. Patients come in also sometimes confused about cysts. They were told they had a cyst. And often cysts are in the ovaries, so cysts aren't fibroids, but certain types of ovarian cysts can have fibrotic type tissue in it, the fibrothecomas. And fibroids themselves, even when they're inside the uterus, can have a cystic appearance, meaning it has something inside of it, like fluid. It's not necessarily solid. And sometimes that happens because fibroids do what's called degenerate, and they can accumulate fluid and blood inside of them. Cedra asked a really great question about green tea, and there is some evidence. The specific question that Cedra asked was, does green tea help alleviate growth and size? And she actually couched it in a very reasonable way, because there's no evidence that green tea prevents fibroids. But the question is very reasonable because there is something in green tea called a catechin. That's a class of compounds that are found in a lot of teas and in other natural and herbal supplementations that generally reduce inflammation. And one of the reasons fibroids bother you, not me, I don't have fibroids, but for women who have fibroids, one of the reasons they're bothersome is because they're surrounded by a highly inflammatory environment. And it's also part of the reason they cause bleeding disruptions. So if you have this inflammatory environment around a fibroid and you can decrease it, then they're less likely to bother you. So women walk around with fibroids all the time that are totally asymptomatic. They have no problems with them, and probably because their inflammatory response is different from somebody else's inflammatory response, or the fibroids are different size or different location. But it's a very good question about the green tea and the fibroids, and it makes a lot of sense. Remember that abnormal bleeding in the uterus it comes from like two main areas, right? It comes from an anatomic problem, whether it's a fibroid or a polyp, and it comes from an inflammatory environment. So if you have an inflammatory environment in the uterus and you decrease that inflammatory environment, then if there was abnormal bleeding associated with that inflammatory environment, then decreasing inflammation is likely to improve that bleeding profile. And it's interesting, people always ask me the question, as a side note, we often give anti-inflammatory medications such as Motrin to women who have a newly placed IUD and are having some, at the very beginning, persistent bleeding. And the main reason for that persistent bleeding is because the IUD has now induced a significant amount of inflammation, and we can cut it down with some low dose anti-inflammatory. So that's and people say, well, I thought Motrin thins your blood. I should bleed more, but the uterine vessels just don't work that way. It's a whole different mechanism of action of stopping bleeding from the tiny uterine vessels than it is in the rest of the body. It's less platelet dependent than it is inflammation dependent. Okay, I don't want to get off topic, but that's inflammation is associated with a lot of diseases. As you're probably all hearing on the news about COVID-19, how important inflammation is in our bodies, and fibroids are no exception to that. Liana asks, Liana, pardon me if I've butchered your name, I apologize. Is there anything one can do to minimize the risk of getting fibroids? And I would say probably not. There are some risk factors for getting fibroids, and I'll talk about those now. One of the risk factors is obesity. And so heavier women or women with a higher body mass index tend to get fibroids at higher rates, and most people believe that's because of the extra estrogen that's produced in the peripheral fat. Remember, we said at the beginning, fibroids are an estrogen responsive disease, and more estrogen is going to make that cook along. Another risk is smoking a risk factor, as far as I know, or is it not?
I don't believe so.
You don't think? Yeah, I don't think smoking's a risk factor either. Um, the other risk factor, actually, interestingly enough, because Sussy asked me about um, birth control, Sussy QW asked me about birth control, and yeah, birth control pills confer a higher risk for getting fibroids. That's not a reason not to take birth control pills if that's the best form of contraception for you. However, birth control pills do increase your risk of getting fibroids. And I don't think anyone clearly knows why. We just have the observation that there's about a 1.6 to 1.8 relative risk of getting fibroids versus people who are not on birth control pills. Sean asks the question, are you performing surgeries now or not? I'm asking because of COVID. Good question. We're back. We are performing surgeries insofar as the hospitals in New York City will allow us to. Everybody's trying to get elective cases back onto the schedule, and somewhere in the back of everyone's head, I think they're trying to beat a second wave into the operating room and get their patients taken care of. Yeah, the operating rooms are tight. We just got our block time back at 2 different hospitals, so we're really excited, and so we're cruising along like we were prior to COVID with regard to surgical procedures.